Hey guys, it's Dr. Emer. We're nearing the end of the day on Friday. It's always filler Friday because that's when everyone, if they bruise, they have a weekend to heal, so it's no big deal. So we have one of my patients today that allowed me to show you temple filling because we just showed a male temple filling on our Instagram, which has gotten a lot of DMs. We talk about, if you look at mine, I definitely need them. Take a look. You can see some hollowing there. You can see some dropping of my brow. This is starting to recur because I'm in my 30s and I'm starting to lose some volume. Things are starting to sag, but also because I work out a lot. When you work out a lot, especially if you've had weight loss and hormonal changes, the areas of the temple can lose volume and also cause muscle atrophy. And there's a big muscle here on the side of your head called the temporalis muscle that kind of basically shrinks in as we age. So if you look at, we have our gorgeous contoured woman here, high cheekbones, beautiful jawline, beautiful lips. But then here you notice, no, not something we typically just go looking at. We can see there's a little bit of like a hollowing here. And to really make this all come together, we call this the OG curve of the face. We can use a little bit of filler along the bone here. And it's a weird sensation. I'm going to inject, go right along the bone. We go all the way down and we just inject a little bit of filler in that region. Now, I showed you guys before this one insertion point. With this insertion point, you can typically get almost all of the temple. We go, and I actually have my thumb, and this is a kind of a trick for injectors out there, on the artery. I can feel the artery right here, so I know I'm not near the artery. Okay, I'm touching it in both places, here and here. So I'm not near the artery, and so I can reposition. I can go to the superior portion of the swimming pool, that's what I call it here. I can go to the superior lateral portion, bring that back here, and then I can go to the deep dive all the way down to the inferior portion of the swimming pool and give a nice little kind of hot filling out to the temple there through one insertion point. Now look at, if you look at here now, look at that lateral view, and then look over here, you can see that that hollowing is now gone. You know, we really were able, and it's actually in this position even better, but you can see that there's hollowing here and there's not much hollowing there. And that's all from one syringe. So now we're going to go to the other side. And did that hurt at all, or?
No, it just feels like pressure.
Yeah, it's weird. It's a weird, and everyone has a weird sensation. I always tell people, tomorrow or the next day you might feel a little pain when you chew because the temporalis muscle helps you contract your jaw. Because you go like this. Think about when you bite, you can feel the muscle up here in your head moving. So you may have a little pain when you chew, so don't freak out. So again, we feel for that artery. I know where it is. I go right in that middle of the temple, small insertion point through that muscle. I feel right along the bone. Perfect. Just nice and slow. The slower you go, the less painful it is, less likely of bruising and swelling. Lots of research shows that the speed of injection is what influences the pain, the bruising, and the reason patients would come back to you. So again, we can go a little bit more in the superior portion. I can go a little bit more in the superior posterior portion. Right there. Or the temple fluid fusion line, and then we go all the way down, deep dive into the deeper portion of the temple. One insertion point, getting a nice fill. So you can see here right now, the temple has been contoured, but the second component to really influencing the temple region is the brow. And this is my favorite, because this is what the women see. They always want this gorgeous lateral lift of the brow. So we go along the bone, right along the lateral, right under the brow. And as we age, the superior or the posterior brow fat pads kind of fall apart, they go down. So we're gonna go right along the bone. It's weird feeling, okay? We're right along the bone here. Good, and we're right under the bone. And I'm just feeling the bone. I'm just gonna inject a small amount of product. And what we're using is Prolinium Versa, or Reviness USA Versa. This is a newer filler to the United States, but very popular outside the United States, specifically in Canada. And I just went to Canada to speak about it. We like it because this filler, interestingly, is what's called prehydrated. And what that means is, a little movement here, there we go, is that it doesn't really swell that much. It already has the water in it that fillers would normally hold when they interact with the tissue. And so we're not really concerned. What we see is what we're going to get. So now we go a little bit higher in this little triangle, the superior aspect of the lateral third of the brow. I'll give a little nice deep bow here, a little nice deep bow over here. And then what I do, just massage. Hold that, we massage right in there. And now look, the brow is just lifted a little bit laterally. Give it just a little bit more. And this is gonna last a year, it's gonna be gorgeous, and it's a nice filling out of the upper brow. It's gonna be great. So now we turn this way, a little pinch, same thing. By using a cannula, which is a blunt-ended instrument, it's much less likely to get any bruising or swelling. And we're able to go literally across the bone here where there's nerves and arteries under muscle and not damage anything. Some people get a little bit of a brow movement or a brow drop for just a short time. That will go away, just the filler has numbing in it. A little movement around the nerve. Okay, we're using that cannula, working our way into that fat pad right behind the brow. See, we're just giving a nice amount of filler there. Lateral brow. Okay, now we massage it over, get really even, nice along the brow, feel the rim. Beautiful, and you can see that nice lateral lift right there. This is something people typically would do in surgery with fat. We're using fillers to do this. Great. Just giving a little extra in the lateral brow. Same thing on the other side, just a little bit, teeny bit more. Again, massaging that into the temple region, into the forehead. Is anyone saying anything? Are we good?
We're good.
Perfect. We're all amazed.
Hi from
You're
Canada.
shocked. What?
Hi from Canada.
Hi, we love you in Canada. The Canadians are following us now because we're using the Canadian products. So I just do a light massage on this area is one of the few areas I actually do massage. I feel that the filler is nice and smooth along the bone, and that's it. And then we take a look, and it's lifted. You can see here, much more filled out, lifted, it's beautiful. Not even a single bruise. So that's temple and forehead contouring in a younger female to just balance and contour the upper face.